Yes, Kaya. Yeah. Bye.
Who's on the phone? Can you take another phone call? I think Caleb's calling you again.
No, he's not.
Oh, he's not calling?
That was Amy calling me, but she's not on a phone call.
Oh, she's all done on the phone? We are at the doctor for Abby. She had another fever this morning. You want a game? You want to play a game? How about you take one more phone call and then I'll play a game on my phone?
No, and those phone calls.
Oh, okay.
I did lots of phone calls.
You did lots of phone calls already?
Yeah.
All right. We'll do a game. So the doctor appointment went pretty well. I brought some documentation with me about the episodes that Abby's been having. And we have documented episodes of high fevers without many other symptoms other than a sore throat or even strep throat since February of this past year. And the doctor did say that if it's cyclical or if it's like on a routine basis and it occurs every 6 weeks or 7 weeks or 8 weeks or even sooner than that, then there was a good chance that she could have an autoinflammatory disease called PFAPA. And I can't even remember what all of the letters stand for, but I know that it's periodic fever something syndrome. So basically, kids with this syndrome have spike high fevers on a routine basis. They're totally fine between episodes, and then within the episode itself, it causes a lot of inflammation in the body, which can cause the lymph nodes to be swollen, causes a sore throat, can cause mouth ulcers, it can cause headaches, stomach aches, and basically any kind of ache since it's inflammatory. There's not really a cure. They don't even know why some kids get this. It's actually not that common, but usually kids outgrow it by their second decade of life. So there's some hope, except the fact that it's really horrible every single 6 to 7 weeks for Abby when she just spikes fever out of nowhere. I give her ibuprofen to bring the fever down, which does help, but you know, she's still achy and she's been complaining a lot of her mouth hurting or having a sore throat. From what I've researched and what I've been told, if this is what Abby has, for sure, her case is extremely mild. So I'm actually really grateful for that, because some kids get really, really sick. And at least she does have the high fever, but at least she's not getting like horrible headaches or stomach aches or vomiting or refusal to eat or dehydrated. So at least grateful for that, but it is a little bit disheartening because it's not curable. There's nothing we can do except manage the symptoms for her. So we're just gonna go to a rheumatologist and an infectious disease specialist to see what they have to say. Okay, so we did take Abby to the rheumatologist, and they did a complete physical. They checked her over. Everything seems to be good as far as in between episodes. Her blood work actually shows that there's normal levels of things. Everything they tested for is fine. So in between episodes, we've confirmed that she is normal, active, everything is working the way it should be, which is exactly what happens in patients or in kids with this syndrome. So that is consistent with having these fever episodes. And the rheumatologist does agree that there seems to be definitely a component where she is reacting or having an inflammatory response. In these types of children, she said they're actually not necessarily autoimmune diseases, they're actually autoinflammatory diseases. There is a difference, and for some reason her body just becomes inflamed and it causes the fever versus the other way around. So there's a strong suspicion for it. There is no blood test for it. There's no cure for it. It's really just going off of the symptoms and going off of the charting of the symptoms and the timeline and everything that goes along with it. So the rheumatologist overall was happy with everything that I brought in, all the documentation I provided, and she does think that there is a component to these fever episodes, but we are going to continue to monitor her to see if they continue to happen on a regular basis, or if there was a seasonal component to it, or if it was just really unfortunate luck that she was sick a lot this past year. So we're just going to have to keep monitoring her. Like I said, unfortunately, there's not a cure for this. So when these episodes happen, the best we can do is give her ibuprofen and just know that it's going to take 4 or 5 days for the fevers to go away and for all the inflammatory symptoms to come down. There's really nothing else we can do except make her comfortable. And she does seem to eat and drink okay when the fevers come down, once that medicine kicks in. So that's a good thing, because kids can become extremely dehydrated, and with the mouth ulcers, they don't want to eat, so they actually refuse food. So at least we're maintaining some sort of routine once we can get the fever to come back down. Now, once that fever spikes, she becomes more lethargic, she's very tired, irritable, she doesn't want to eat or drink anything. No one does when they have a fever, so I totally get that. So it's really just about trying to be proactive in giving the medicine, keeping the fever down, not waiting too long to make sure that she isn't getting that fever too high before she kind of completely shuts down. So I'm glad we went to the rheumatologist. It did give me some peace of mind. It's a little bit of a scary situation as a parent to navigate through something that A, isn't common, B, doesn't have a cure, C, you can't absolutely definitively test for, but having some really reassurance that, yeah, she has a lot of these markers, yeah, she has a lot of these symptoms, there's a good chance this is an autoinflammatory syndrome, and here's how we manage it, and here's what we do going forward, does give me some peace of mind as a parent. So basically all we're going to do is monitor Abby, just like we've been doing, continue to document the episodes, chart it, give her medicine as appropriate. In severe cases, or when kids have this happen very frequently, especially as they get older, you can give steroids to kind of bring down that fever, but they're reluctant to do that right off the bat just because steroids can be aggressive and these are happening all the time, so you're giving all the time. So for now, we're just going to stick with the ibuprofen, which has helped not just bring the fever down, but also the inflammatory responses in her body. So we'll go with that. We'll continue to chart. We'll see how it goes. I held off on the infectious disease doctor for now just because I got so many answers from the rheumatologist, and we're going to go from here and just continue to manage Abby's symptoms, and hopefully this will be something that we can manage well over the years and that she will outgrow when she becomes an adolescent, and when they hit puberty, they typically start to outgrow these symptoms. So that's the hope, and we're just gonna continue to work with Abby and have her have a normal childhood as much as we can, and she's a happy, healthy girl.